What do you do with your hands?
Hey Connor, how's it going?
Good. How are you? Ow, that really hurt my hand.
That's too bad. What brings you in today?
Oh, actually, this hand issue. Like I was having some really severe pain in my thumb, and then I went to my doctor. He said I had something called osteoarthritis.
Oh, wow. In
Like,
in
I've never
your
heard of before.
Did he tell you which joint it was in, or just your thumb?
I can't remember if it was the thumb joint. I think the CMC. I think it's called.
Yeah. So if you're having some pain around here, that's probably the joint that's hurt.
Okay,
Is that it?
I think so. Yeah.
All right. Well, regardless, today we're gonna do some tests just to see how your range of motion is, how your strength is in that thumb.
Okay.
So with that said, I'm gonna have to be touching your hand and moving it in different ways.
Awesome.
So do you have any questions about that?
No, I can't wait.
No. Awesome. So with that said, do I have your consent to continue?
You do.
Perfect. So if at any point you feel uncomfortable or there's some severe pain, let me know. We can stop. We can try something else.
Okay.
So first things first, I'm going to check the active and passive range of motion. So basically what that is just how you can move your thumb. So what I want you to do first is I'm just going to hold onto the fleshy part of your thumb here, and you're going to push it down, and that's flexion. You're also going to pull it up, and that's extension. You're also going to go away from your index finger, which is abduction, and then towards, which is adduction. So we're going to start with flexion. I'm just going to grab here. You can push as far as you can go. So you're going to push that thumb down.
Sure.
Okay, and then I'm just going to apply some overpressure.
Okay.
Good. And then you're going to go upwards this time. I'm going to apply some more overpressure. How's that?
Good.
Good. So now, same position, you're going to abduct. So you're going to push that thumb away from your index finger as far as you can go.
Okay.
And I'm just going to push it a little bit farther. How's that?
Yep.
So now, adduction, you're just going to kind of open your palm, and then you're going to pull it as close in as you can.
Like so?
Yeah, and then I'm just going to apply a bit of overpressure on your bone here. Perfect. So you did good with those. And so now I'm going to measure abduction with a goniometer here. So this just gives us a baseline measurement to see where we're at.
Okay.
First things first, we would usually do your unaffected side, but because for time constraints today, we're just going to do this side.
Okay.
So what I'm going to get you to do is have that arm out, and then I'm just going to put this under your wrist. So it's just so we have a good spot to go. So pull that up, and then have your hands out. Probably move your arm back a little bit, just so have your pinkies rest on there. So I'm just gonna find CMC joint here, and then I'm gonna line up my goniometer with your index finger, and yeah, if you just keep that position. So we got you started at about 15 degrees. So now I'm going to get you to abduct your thumb as far as you can. Perfect. So as far as you can go.
Yep.
So we got you at 45. So 45 minus 15 got you at 30 degrees. I'm just going to see if we can get you a little bit farther. I maybe got 1 degree, so 31 degrees out of there.
Okay.
So now we're going to test the muscle length of your right hand finger extensor muscles. So I might get you to come kind of to the end of the table here. Move this stuff out of the way.
Sure.
You can let those fingers hang off. So basically what the test is, it's testing your muscle length. So what I want you to do is get as far down as you can, and then I'm going to push a little bit more to lengthen out as far as we can, and then I'm going to get you to try and pull those fingers back up to your wrist.
Okay.
So if you get as far as you can go first, and then I'm just going to apply a bit of overpressure there, and you can pull those fingers up now. Nice, good extension.
Is that good?
Yep.
Okay.
That's the test there. So now we're going to do some strength testing of a couple joints. So you were saying your CMC joint is hurting. So then we also have another joint here and another joint here. So first one, I'll probably get you to back up again, and then just for an easier position. I'll get you to have your arm up like that too.
Okay.
So the first joint, I'm going to test the strength of this one for flexion and extension.
Okay.
So basically, you're going to try and keep these bones isolated, and you're just going to move that thumb. And then I'm just going to be here to test the strength.
Yeah.
So I'm just going to hold.
I didn't even know I could do this.
Yeah. And you can go.
Okay.
So this is minimal. We're going to go moderate. 1, 2, 3. And we're also going to go max here. 1, 2, 3.
Is that all you got?
Is that all you got?
Pretty much.
It's good. Okay, so now same thing, but you're gonna be pulling that thumb up to the sky as high as you can.
Okay.
So on the count of 3, you go. 1, 2, 3, and we're gonna go moderate. Ready? 1, 2, 3, and maximal effort here. Ready?
Okay.
1, 2, 3. Good. So now I'm gonna move to this joint here. So we're gonna try and you can just keep this straight and try and only move this bone here.
Okay.
So same thing, you're going to try and flex that down. I'm just going to isolate this joint here. So go ahead. This is minimal. Perfect. And we're going to go moderate. 1, 2, 3. And then maximal. Ready? 1, 2, 3. Now we're going to do the same thing, but you're going to be going into extension, pulling up. So ready? Go ahead. 1, 2, 3. And again, moderate. 1, 2, 3. And then once more. Max. 1, 2, 3. Awesome. Okay, great. So lastly, we're just going to move into some to test the strength of your abduction. So first one, I'm just going to get you lined up again. Have your thumb touching your index finger, just like so. Awesome. And then I'm going to come in here and I'm just going to apply some pressure, and you're going to push out as hard as you can.
Okay.
So minimal resistance. You can go ahead. 1, 2, 3, and then moderate. 1, 2, 3. And then we'll go maximal. Ready? 1, 2, 3. All right. And now we're gonna get you in a different angle to test that strength. So we're gonna get you kind of up into a 45-degree angle and try and keep that thumb straight. And then you're gonna pull out from up here. Does that look like you can do that?
Kind of like this?
Yeah, for sure. And then I'll just be here to test that strength.
Sure.
Sure. So you're in a good position.
Mm-hmm.
And on the count of 3, 1, 2, 3, go. It's minimal. 1, 2, 3.
This is a lot harder.
Moderate. 1, 2, 3. And then we'll go max. 1, 2, 3. Good. Strength looks good. So now the last question here. If the patient was able to maintain the test position for thumb abductor strength testing but was unable to maintain it when mild resistance was applied, we would give them a strength grade of 3. Good job.
Yes. That was good.